Welcome, David Hume and Jill Fredel. We're going to talk today about addiction and the fact that 100,000 people a year are still dying from addiction. And Dave, you have this wonderful slogan, where there's life, there's hope. How did you become involved here?
Well, my involvement with atTAcK addiction and advocacy on what I've been calling the public health crisis of the 21st century was due to the loss of my son, Greg, to an accidental overdose. Greg was, I have two sons. They were a year apart. And if they were 10 and 11 years old and you said, one of my sons is going to end up being a heroin addict, I would say, oh, it's Dave, because he was the one always pushing boundaries. And as it turned out, it was Greg. And one of the things I found out along this journey is that it's not the people that necessarily push boundaries. It's the people that are looking to fit in a little bit more. And Greg's addiction escalated, started with marijuana, and eventually he used heroin. His heroin use actually took him to prison, which just scared me to death, him going to prison, because he was a very fair-skinned, fair-haired guy, and I guess I had seen too many cop movies. So, he did serve his term, and I'm originally from Pennsylvania. He moved to Delaware. He lived under my roof, and at the time, he was doing absolutely everything right in his life. He was engaged with my wife and I. He wasn't sitting up in his room being on a computer or his phone the whole time. We laughed, we joked, we watched TV and sports together. He was going to bed early. He was getting up early, doing some meditation. He was getting ready to participate in one of those mud ruckuses for MS, and he was doing everything right in his life. He was working for me, and he was doing a great job, and it gave him a career path where he would never have to check the box that said, have you ever been convicted of? And he was gradually...
This could be anybody's child.
Absolutely.
Anybody's child.
Absolutely.
And it doesn't have to happen anymore. Maybe we can get into this because I know that
it's not just anybody's child, it's everybody's child.
Yeah.
It's everybody's child. So Greg was reacclimating his life with the people who were the good guys in his life. And when he was out one night, he ran into some of his old running mates. He thought he could, use once again, and it was a decision that proved to be fatal. He overdosed. He was taken to the lot of a hospital, driven in his own car there, and just left there. They did not call 911. They did not hit the button on the emergency door. They did not hit the panic button on his key fob and run like crazy. They just left him there. And by the time he was discovered, they rushed him into the hospital, but it was too late. And the investigating detective said to me, if we had a 911 Good Samaritan law or Narcan law, your son might very well be alive today. At that time, I didn't even know what they were. And,
great. But that's your focus now. Quickly, Jill, or not quickly, Jill Fredel, so nice to see you again. Can you talk about the mission of the organization and why you got involved?
I think, in an atTAcK addiction, we have a saying, nothing about us without us. And clearly the people who are involved with atTAcK addiction, whether it's on the board level or volunteers, they are grassroots. They know the people in the community. If you ask somebody in a room to raise their hands, if they know anybody who suffers from addiction, almost all of the hands would go up today. And that's sad and unfortunate. And the role that atTAcK addiction can play, because we are of the community, is to be that resource for people, whether it's education, awareness, prevention, recovery, whatever it might be for people. We can be that starting point. There are so many parents with adult children who find out that they are suffering from substance use disorder. One of the first calls they usually make is to somebody who is a board member or a member of atTAcK addiction to find out, what do I do? I have no idea where to start. And we can be that starting point in terms of just awareness, education, the resources that are available to you, to a loved one. when you're trying to enter treatment, how do I get connected to somebody in treatment? Where do I go for residential treatment? What do I do? And a lot of times parents and families just typically throw up their hands. But in addition to that connection to treatment, we are a support for families who are going through this.
All right.
I can't tell you the number of people who have called Dave, who have called me and said, I'm at my wit's end. You know, they've relapsed. What do I do? And you need that emotional and mental support as well.
Of course.
And,
I have the greatest respect for individuals and families attempting to deal with this.
I have to add here too that, you know, really, I can't say enough about Jeannie and Ton Keister, because they started atTAcK Addiction.
Right.
If they hadn't started it, Jill or I would not be here. And they started that group within 2 months of their son's accidental overdose death. To do that, the group was started as an open, transparent group, action group. It wasn't started as a support group. So I really have to give a shout out to them, because without what they did so soon after their loss, you know, a lot of these things may not have happened here in our state.
The courage, the love, it's just unbelievable. All right, we know a lot more now about addiction, particularly opioid addiction, and there are remedies that paramedics and police and others can have to, at that terrible moment, save a life. Do you want to talk about that, Dave?
Yeah, absolutely. Again, you know, part of it stems from my conversation with the investigating detective. And one of the first things that atTAcK Addiction did as an organization is we passed the 911 Good Samaritan law in 2013 that granted immunity to people for making a call to save somebody in medical distress. And it's really important to know that that law also applies to minors and underage drinking. And that's a huge thing. Everybody thinks about it with the opioid aspect of thing, but it's really huge when you think about Friday night football games, kids in high school drinking for the first time. And we have to continue to get that word out of there. So, you know,
and I just read, I'm not sure the public is completely aware just how lethal alcohol abuse has gotten with kids.
Yep. Absolutely. But the naloxone, after in 2013, we passed the Good Samaritan law. Naloxone was the next step. And you have to understand, when we first got together, you know, our little joke was, but it was, you know, truths in jest. We were a bunch of dumb moms and dads trying to figure this all out. How do you pass a bill and everything? And
sure.
we were really fortunate there. So our decision was, do we try to do 2 bills at once in 2013? And we decided we'll do the 911 Good Samaritan because it won't cost the state any money. And if we're successful, then we'll follow up with naloxone. And we worked with then Senator Bethany Hall Long on that bill for community access to naloxone. And we passed a really good bill back in 2014 to allow community access. One of the things is that you can always improve programs. We improved the program, so we came up with not just one organization that could go out and train the community, but we had a train the trainer, portion of that, so that now other people could be trained to go out and train other people in the community, so we can get the widest possible distribution of naloxone as possible. And that's been a great success. We know it's saved a lot of lives having that naloxone there.
Before we run out of time, Jill, this is everybody's problem. It really is. Every caring person's problem, for sure, in our Delaware community. What can we do to support you? What would you like to see happen?
I think more connections to atTAcK Addiction. We can be that kind of pathway for people who have a loved one who is suffering from substance use disorder, or it's a parent who's worried that their teenager could potentially suffer from substance use disorder, and they want to know ways that they can act in terms of prevention, and just talk with their children about, are you tempted by this? Have you seen opioids in your school? Have you seen fentanyl in your school? we need to have that discussion. I think that awareness is critical. We have seen, I used to work for the state of Delaware in the Department of Health and Social Services, and we have seen that stigma reduced across our state. And that's in large part to atTAcK Addiction and the work that that organization has done in terms of advocacy. Dave is very humble about the things that atTAcK Addiction has done, not only the Good Samaritan law, the greater access to naloxone to help revive people who have overdosed, not only for first responders, but without a prescription in pharmacies. That's been huge. And this summer, we're looking at naloxone being available over the counter in pharmacies. So just the availability of that to be able to help someone survive an overdose is critical. We cannot do anything if we don't help people survive to the next day, to the next day, to the next day. So I think across the state, Delawareans, what they can do is not stigmatize people who are suffering from addiction. It is so common. We need to support them, figure out ways, whether it's housing or transportation or childcare or food, just those basic necessities. If you are suffering from addiction, you may have lost your job, you may have lost your place to live, you may have entered residential treatment, and maybe you're coming out now. And that's what atTAcK Addiction does. We have recovery homes, Sharon, where people who are coming out of that residential treatment can go live with other people in recovery, have that support. I think one of the most important things is not to go back to where you were.
Of course.
Because there may be those bad relationships or triggers that may lead you back to a relapse, but to live with other people who are walking that same path that you are is really important in terms of that support.
As Dave says, where there's life, there's hope. And I hope you will come back and we can continue this conversation.
Absolutely. If I can just add one more thing.
Of course.
One of the things as an organization we are proudest of is back in 2019, we led the effort to pass the nation's first opioid impact fee law, which put a small fee on the manufacturers of opioids sold in the state of Delaware. And our law was never challenged by the manufacturers of the opioids, the Purdue farmers, never challenged in any court at any phase along the way. And we have money coming in to do some of those things that Jill mentioned to help those people in the area of social determinants. So that's a big thing. And there wasn't enough publicity on that when we did that. And, you know, it's just really important because it's an additional step in saving lives.
Of course. Dave Hume, Jill Fredel, the organization is atTAcK Addiction. Thank you so much.
Thank you, Sharon.
Thank you, Sharon.